Hi everyone, my name is Svetlana and welcome back to my channel. In today's video, it's all about the teeth, my daily oral hygiene routine. I'm gonna mention briefly that I'm a dental hygienist by profession, so today I'll show you how to keep your teeth extra clean and extra white as well. So let's just go ahead and get started. The first step and the most important step is brushing your teeth. You have to brush them for 2 times a day for 2 minutes. You can use a manual toothbrush or you can use an electric toothbrush. I have both of them right over here. This is the manual toothbrush, this is electric toothbrush. If you'll ask me or if you'll ask any other hygienist, they will recommend an electric toothbrush. It cleans your teeth a lot better than a manual toothbrush and it's extremely easy to use it. All you have to do, just push start and then place it on your teeth. Make sure that you have your 45-degree angle so the bristles go toward the gum line, and all you have to do, just move it around. You don't have to make any circles, you don't have to do anything. But if you'll decide to go with electric toothbrush, please use it for at least 2 weeks. If you'll go with Phillips Sonicare, this is the one I have over here and this is the one I love too much. I've been using it for 10 years, but when I started using it, it was extremely uncomfortable. It was tickling my gums and I just did not like the feeling. After I've brushed them for 2 minutes, my teeth were so sparkling white and clean, and I just had an amazing feeling. Now, picking the right toothpaste is another extremely hard decision, especially if you don't know what you're looking for. So what I recommend for you to look in ingredients. On the back of every toothpaste, there's a list of ingredients. If you have sensitive teeth just like me, I look for potassium nitrate. And potassium nitrate, it helps with sensitivity. The next one, if you don't have sensitive teeth, then the next one, and it's super important one, is the sodium fluoride. The higher the concentration of fluoride, the better, because it prevents from cavities. So the toothpaste that I love too much, and I've been using this toothpaste for the last 15 years, it's a Sensodyne ProNamel. This is a great toothpaste for sensitive teeth. I love the taste of it. I love everything. The other one, if you don't have sensitive teeth and you're just looking for just a great toothpaste, the good ones are Crest, and the one that I have in my hand is Crest Cavity Protection. This one has fluoride and it has a good taste. It has a good aftertaste too, so this is a good one as well. So if you go to your hygienist, if you see your hygienist and a dentist every 6 months, and for example they tell you, okay, you have another cavity and another cavity and another cavity, I want you to ask your dental profession about Colgate PreviDent 5000. This is a specific toothpaste for prevention of cavities. It has 1.1% sodium fluoride, so it's a lot higher than any other toothpaste. This is a prescription toothpaste, and the only way you can get it is just by buying it at your dental office, or if your dental office will give you a prescription for this toothpaste. Let's move on to the next step, and this step is as important as the first step, brushing, and of course you guessed it right, it's flossing. You have to floss your teeth once a day, and the floss that I have in front of me, and I love the string floss a lot better because it's easier to use and it cleans so much better. And this one is Oral-B Glide. It doesn't really matter which one you're choosing. This is just the one that I prefer. But if you do like floss picks, you can use them as well, as long as you're flossing them. But the hardest thing was the floss picks. You cannot always make the C shape that we want you to do. So with the string, you just get a string, you wrap it around your fingers, and then you go in between the teeth and then kind of make you make the C shape, and you go all the way underneath the gum line, and then you make a scraping motion, and then you move on to the next tooth. It's extremely hard to do it with the floss picks, so that's why I do not always recommend them. But if you like to keep them in your bag, at work, wherever, in the car, and just use them in between the meals, this is a perfect solution as well. Just make sure that you floss them once a day and you floss them correctly. If you don't know how to do it correctly, ask your dental professional and they'll be more than happy to show you how to do it. Okay guys, let's talk about your breath. If you've ever wondered why after brushing and flossing your teeth you still have a little bit of a nasty taste in your mouth or a stinky breath, you probably forgot to brush your tongue. And there's tons of different products that you can use to brush your tongue, to scrape your tongue. The things that I use is just a regular toothbrush. You don't need nothing specific, you don't need nothing extra. If you use it, it's totally fine, but I use just a plain toothbrush. It's extremely important to do it because that's what gets rid of the stinky breath and nasty taste in your mouth. So please don't forget to brush your tongue every single day. The next step and the last step for my daily oral hygiene routine is of course using a mouthwash. The one that I love a lot, it's Anticavity Fluoride mouthwash, and I use this one just once a day at night after I brush my teeth, after I floss them, and I do all of that good stuff. And you just rinse it for 1 minute once a day and you are done. I prefer this mouthwash over Listerine because Listerine just gives me a really crazy burning sensation, and just because it contains alcohol, I do not like this one as much. I always get a lot of questions asked about the teeth whitening. Is it safe? Is it not safe? Which products to use? Where to get them? And so forth. So I decided to include this portion in this video. Let's just go ahead and get started. I'll show you a couple different products that I personally use or I've used them in the past and they work. So let's start it with the first one. The first one, and I have only one little strip left from a long time ago. It's a 3D Crest WhiteStrips. And the one that I have, it's a gentle routine. There's tons of different ones at the stores. You can buy them at the stores, you can buy them online. It's just, they're kind of all over the place. And it's super easy to use them. It comes in one package. There's two different strips, one for the top teeth, another one for the bottom teeth. You just basically put them on, leave them for however long it says on the package, and then take them off. You can use them for as many times as you want, and this one's a little less concentrated than the ones that you can get at the dental office because this is non-supervised bleaching, so they cannot make it as strong as the one that you get at the dental office. So I've used them in the past and I don't use them anymore because I get bleach from my office and I love it. It's more convenient for me and I just like it a little bit better. So the one that I liked at my office, I made a custom bleach trays, and they're just simple, clear. It's super easy to use. They're very flexible, so they're really nice. And I picked out bleach, and this is the tube that I got from my office. Your office might have a different one. It doesn't really matter which one you're using. They all work extremely well, and the only one suggestion that I would do, they all have instructions on the back how to use them, but if you do have extremely sensitive or just sensitive teeth, then whatever it says on the back of the package, for example, wear 1 to 2 hours daily and then use it for like 10 to 12 days in a row. My teeth are extremely sensitive, so I do not ever do it. If it says 1 to 2 hours, I usually just do it for 30 minutes and then I do it more often. And then as soon as I feel like my teeth getting a little more sensitive, then I stop for like 3, 4, 5 days, maybe even a week, and then I do it more if it needs to be. Just wanted to mention that everybody's teeth are very different different. So if for one person it will take only 1 to like 3 times to bleach it and then they have perfectly white teeth, and if it's taking you 10, 12, 15 times to bleach it, that's totally fine. Just keep going, just keep doing it, and you'll get to the results that you want. So that's it for this video, guys. If you enjoyed it, go ahead, give me a thumbs up. If you like my content, if you want to see more, please go ahead and subscribe. I will leave all of the products down in the description of this video. Thank you so much for watching it, and I'll see you in the next one. Bye bye.